breaking news.
That breaking news is coming to us right now from Chicago. Health officials now confirm a second case of the coronavirus in the U.S. The newest patient is a woman in Chicago. Right now, Chicago and Illinois leaders are addressing the case. Let's listen in live.
The patient is a woman in her 60s. Most importantly, I'm pleased to report that she is clinically doing well and is in stable condition. She traveled to Wuhan, China in late December and returned to the U.S. on January 13th. A few days after arriving home, the patient began to feel unwell. She called ahead to alert her doctor to her illness, rather than just presenting to a clinic or emergency department. This is exactly what any potentially ill returning traveler from Wuhan should do: call ahead and seek medical care. This patient's doctor's office appropriately asked about travel history and quickly put a mask on the patient, helping limit the potential risk of spreading infection. Her doctor then referred her directly to a hospital with infection control capabilities for further workup. Again, this is exactly what we've been educating local healthcare providers to do. Ask about travel history and reach out to your local public health department to discuss any ill patients with recent travel to Wuhan, China. Hospital staff then placed her in the appropriate setting for infection control, performed a full clinical workup, including ruling out more common viruses like influenza, and worked with public health to arrange testing for novel coronavirus at CDC. The patient is clinically doing well. She is currently in stable condition and remains hospitalized primarily for infection control. While we will be following her course closely, the patient's story so far highlights the way public health messaging and awareness are working locally, as well as the importance of coordination and awareness in the clinical setting. The patient has been very helpful as we've been gathering information about her contacts in recent days. She was not symptomatic when flying. And based on what we know now about this virus, our concern for transmission before symptoms develop is low, so that is reassuring. She has limited close contacts, all of whom are currently well and who will be monitored closely for symptoms. We will also be monitoring the healthcare workers who have cared for and continue to care for this patient. Since returning from China, the patient has had very limited movement outside her home. Now that this test is positive, we will continue to collect and confirm even more information about her activities and contacts. But we know already, for example, that she has not taken public transportation. She has not attended any large gatherings. And actually, to our best knowledge at this point, she has not had extended close contact with anyone outside her home since returning from China and prior to admission to the healthcare system. So this is all very reassuring in terms of infection risk to the general public, which again remains low nationally and locally. Anytime a new virus emerges, we are reminded of how small our world is and of how critical it is to invest in building strong public health systems. I want to thank the federal, state, and many local partners who have worked together and prepared, not just to respond to this case, but over many years to ensure the Chicago area is well prepared to respond to emerging infectious diseases. I'd now like to hand it over to Dr. Jennifer Layden, the Chief Medical Officer and State Epidemiologist at the Illinois Department of Public Health. Sure. My name is Dr. Allison, Allison Arwady, Arwady. I'm an MD, and I'm the Commissioner at the Chicago Department of Public Health.
Thank you, Allison. Hi, my name is Jen Layden. I'm the Chief Medical Officer and State Epidemiologist for the Illinois Department of Public Health. Yes, Jennifer, Jennifer, Layden, Layden. I would like to start by thanking our Governor, Governor Pritzker, state leadership, and IDPH's Director, Dr. Ngozi Ezike, as well as the Chicago Department of Public Health, other local health departments in Illinois, healthcare partners across the state, and the CDC for the coordinated and collaborative work on this rapidly evolving situation. It is because of the diligent work by healthcare professionals that we were able to identify this confirmed travel-associated case of the novel coronavirus quickly while also taking measures to prevent others from being exposed. IDPH has been closely monitoring this international outbreak and began proactively preparing in the event the outbreak expanded. We began providing CDC guidance, resources, and recommendations to local health departments, hospitals, and clinicians across the state, and developed a dedicated web page with resources for the public and health partners. We have sent several health alerts and updates to local health departments, clinicians, and hospitals across the state, and held a webinar for local health departments this week, which had over 200 participants, and a webinar for clinicians and hospitals, which had over 500 participants. We will continue with frequent, scheduled communication with local health departments, clinical partners, and other key state partners. Coordination between the hospital, local, and state health department allowed specimens to be shipped and tested at the CDC quickly. This coordination between providers, hospitals, and public health is critical for our continued effort to best respond and reduce further transmission. The Illinois Department of Public Health will continue to partner with the CDC and has invited a CDC team out to our state to assist with this investigation. IDPH is ready to bring testing online to our state labs once the test is available from the CDC. We will continue to communicate and coordinate with our local health departments and numerous clinical partners as we respond to this evolving situation. I will now turn this over to Andrew Velasquez from the Chicago Department of Aviation. Thank you.
Good morning. My name is Andrew Velasquez, A-N-D-R-E-W, Velasquez, V like in Victor, E-L-A-S-Q-U-E-Z, Managing Deputy Commissioner for Operations, Safety, and Security for the Chicago Department of Aviation. The CDA has no higher priority than the safety and well-being of the traveling public, as well as our airport community. From the moment information came to light about this particular strain of coronavirus, CDA safety and security team has been closely monitoring the situation and interfacing with our federal and public health partners, particularly CDC, CBP, and Dr. Arwadi's team at the Chicago Department of Public Health. We wanted to be sure we'd be able to support any special efforts related to the coronavirus while at the same time maintaining normal airport operations. Our experience in these matters is unfortunately extensive and hard-earned, whether it's a response activation related to MERS, Ebola, or even measles. But we also have deep relationships with our federal and local partners and are in a position to provide logistical support at a moment's notice, as has been the case here. Once CDC determined that O'Hare would be participating in this effort, we ensured they and CBP could stand up and enhance the risk assessment screening process immediately, and those assessments have been underway since Wednesday. In addition to our valued travelers, we are working hard to ensure the tens of thousands of individuals who make their living at O'Hare Airport have the most up-to-date information on the coronavirus, as well as ongoing efforts to keep the public and our airport family safe. We are grateful to our public health partners who have been an excellent resource in assuring our airport community and their risk of transmitting the virus is extremely low. Later this morning, our CDA emergency management team will convene a briefing call for airport stakeholders, and we will be distributing additional information about the coronavirus to all airport employees, as well as reminders about what steps all of us can take to maintain good health. We are committed to providing both information and reassurance, and in this case, those go hand in hand. Thank you very much, and we will now open it up for any questions that you might have. Thank you.
The CDC continues to screen at the airport.
What airline if this person was asymptomatic at the airport? So talk about that. I'm just curious, what she taking from that one? So how can you ensure that when she arrived with no symptoms, that what happened timeline-wise? And did she go to the grocery store? Did she go anywhere before she knew
So two parts to that question. So on the question about traveling before a patient has symptoms. So this is one of the reasons that the airport screening, while important, is only one piece of the public health plan around making sure that we appropriately detect people and treat them. Based on what is known now about this novel coronavirus, the CDC does not believe that in the time before symptoms have developed, patients are likely to be able to be contagious, able to be transmitting coronavirus. This is based on what we know about other coronaviruses. So folks may know this new novel coronavirus is in the same family as coronaviruses that include the common cold, as well as that include MERS or SARS. So given that it was a number of days between the time that this patient entered the U.S. And the time that she started to develop symptoms, we, again, based on what we know now, are confident that she was not at risk of travel. We will obviously continue to discuss this with CDC. We're getting more information about this virus every day, but that's the current understanding.
What were the symptoms that led her to develop?
You are listening to officials in Chicago talk about the second confirmed case of the coronavirus in the United States. They're saying that this woman who has the infection, she is in her 60s. They do say she is stable, though, right now in a hospital. She traveled to Wuhan, China last month, and that's where they believe she contracted coronavirus. The first confirmed case was actually in Seattle. Right now, to try and contain the virus, authorities in China expanded the travel lockdown to include 12 cities around that area. That impacts nearly 35 million residents. And latest numbers from the China's National Health Commission say that 25 people have died and more than 830 people are infected with the coronavirus. We'll be keeping you updated on this developing news story throughout the day right here on ABC Action News, streaming now.